Welcome to the next episode of the Many Minds podcast, where our goal is to encourage collaborative community healthcare using many minds for better outcomes. We want to understand what makes your specialty special and how we can support you to provide better care for your patients. I'm Alex Davis, physician assistant, along with Tyler Murray, nurse practitioner.
General disclaimer, this podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We're just here to learn from each other and have a good time. Today on the episode, we have Shelbi Brook. She's in plastics. She's a physician associate. She's been in the game for about 5-6 years.
5 years.
How long have you been in plastics for?
For about 2.5 years now.
Okay.
Yeah.
And I didn't necessarily know you were going to get into plastics.
I had no idea. I had people in my class that were like, yes, I for sure want to do plastic surgery. I went into PA school not knowing what I wanted to do at all.
But knew you wanted to be a PA.
Knew I wanted to be a PA.
I heard that.
Yes, yeah. Knew I wanted to be a PA. And during school, my problem is that I always enjoy too much. And so it was a hard time. I had a hard time like narrowing it down. But at the end of it all, I was like, okay, either ER or surgery. And I had done a rotation at IMC with the ER group there, who was phenomenal. I love them. They offered me a job, and then I got a job in general surgery. And my mentor from the IMC ER, he was like, do general surgery, you're gonna get great exposure. Yeah. And he's like, we'll take you anytime. But now I will never leave surgery. I love it.
There's something about it. It breaks up the monotony. Now, within that realm, let's just jump right into it. Let's find out what the life is like for a PA in plastics.
Help us appreciate plastic surgery.
Yeah.
Awesome.
What does your world look like?
It's amazing. Honestly, I love it. And just to give you guys some insight into our clinic, it's a private practice. So I work directly with Dr. Chittister, who is a plastic and hand fellow trained surgeon. He started his own practice about 5 years ago, but within the last year, he's built this beautiful facility just at the point of the mountain, actually. And there's a spa, there's our whole clinic there, and it has 5 ORs, and it's just like state of the art, wow. Beautiful.
Oh my goodness.
It's about a minute from my house, so location wise couldn't be any better. And so first of all, the location that I work at is just like, it's a pinch me every time I get to go into work. I'm like, this place is beautiful. It's nice to work in a pretty place.
Absolutely.
Yeah, it does. It makes a difference.
It does. It's just a good environment. It smells good. My coworkers are awesome. So yeah, my role as a PA, I got the job unexpectedly. It was kind of just one of the surgeons had reached out to me and said, hey, I heard great things about you. Would you be interested in applying? And at the time, I was like, well, I can just see what it's about. Didn't even know who Dr. Chitty was. Apparently, he's a TikTok surgeon, dancing surgeon. Of course, I know that now. But I met with him and his wife, Mindy, and fell in love.
She works at the office as well,
Yeah,
right?
she's a spa director.
That's
and I just fell in love with him. Like, met with him, felt like I knew him forever. Yeah. So, but my day-to-day, so I run our wellness program at the plastics clinic.
What
so
all
that's
does
the
that entail?
spa side. Right now, it's mostly just medical weight loss, which is nice because I do have experience in bariatric surgery. So I had already been working with overweight patients.
Familiar with that
and
population.
Yes, yeah. So that went really well because I wasn't planning on it. I didn't get hired on to do that. But once Dr. Chester and Mindy found out that I was comfortable and had been doing it within general surgery, they're like, yeah, we've been wanting to open a wellness portion. So I do have 2 nutritionists that work under me. So they do all of the fitness and lifestyle education, which
is a huge component of it all.
Yeah, and it was nice because they understood my vision. I was like, okay, I'm not going to just be a prescription mill where patients come in, I write a script for them, say good luck, and we never see them again.
Those exist out there, though. They
those really do,
very real.
Especially like with the GLP-1s becoming so popular. I have patients coming in being like, oh yeah, I bought my GLP-1 from my hairdresser, or
Like, wait, what?
it's insane. And we have a patient whose neighbor is making it out of her basement.
Oh my goodness.
And, you know, it's interesting. So,
tell me this, myth or not. I've heard they're cracking down on this as far as how we can prescribe.
Yes.
And who can prescribe and under what
circumstance.
Yeah. Is that true?
And they're not compounding it generically anymore. Is that accurate?
So, not completely.
Okay.
So
I've been so confused by this because I've heard so much.
I know, and it's like so back and forth. A lot of the major compounding pharmacies right now are getting sued by Eli Lilly, who is a maker of tirzepatide, Mounjaro, Zepbound.
Yeah.
But there are so many patients that are benefiting from it. They're actually fighting back. They're like, we knew we were going to get sued, but there's no way that Eli Lilly actually has the supply to meet the demand.
Right.
Like, I don't think they realize how many millions of people are getting the medication. Yeah. And it's frustrating because the medication is way more expensive in the United States than anywhere else in the world.
Interesting.
It's like 1/10 of the cost, especially for semaglutide outside of the U.S.
Yeah.
And so compounding pharmacies are still making it. They are adding compounds with it to make it a new medication. So if you add in like B12 or glycine, technically you're making a new medication.
Wow.
And then if you're dosing it at least 10% differently than what the branded medication is, it's also considered a different medication. I just went to a conference, a plastics conference in Austin, and they were talking about all the legalities around it because, you know, you want to make sure you're practicing appropriately, but still providing the care that your patients need. So for our clinic, we don't take insurance at all. We're completely cosmetic based. So we don't even do reconstruction unless if they want to come and pay out of pocket for it. Dr. Chittister is a phenomenal surgeon. He is booked out like 4 years though. And so
I thought we were busy.
Wait a minute, 4 years.
4 years.
And there are people on the wait list just like waiting for someone to cancel or.
Yeah. And you know, a lot of them are doing like family planning around it. So they'll be like, we're going to have our last baby and then I'll breastfeed. And by the time I'm done breastfeeding, I'll be ready for my mommy makeover.
Goodness.
My mommy takeover, as Chitty has coined it, you know?
Love it.
That is some foresight and planning, though. My goodness.
It does. And, you know, it's like, what if you don't get pregnant?
That's crazy.
But he brought in a couple of other surgeons, Dr. Pfeiffer and Dr. Robinson. And honestly, I've never met a better group of guys and surgeons. Like, they're wonderful humans, but they're also really good surgeons. And I bet
that's hard to find in that, realm.
Yeah.
Right?
And, you don't want to bring on surgeons that are egotistical and they're not going to treat the staff well. And I can genuinely say our group is just, you won't find a better group anywhere.
That's awesome.
That's amazing.
So it's really nice to be able to work at a place where I'm like, I'm going to have to see Dr. So-and-so, know?
Yeah.
Because they're all just phenomenal. But
so you got your wellness clinic that
yes,
you kind of oversee.
So GLP-1s.
Primarily weight loss. And then
yes, and what I was getting to is...
Sorry, I derailed
No, you're totally fine. I'm like looping, but... no insurance, but I will for my patients if they meet BMI requirements of the 27 BMI with a comorbidity or 30 and above with a comorbidity and they have insurance, I will do a prior auth and submit it through insurance. It takes up so much of my time.
Yeah.
But I'm like, if I can save my patients some money and they're
huge.
Able to just get it, covered for a year, I will do that for them.
And you don't traditionally do that, so you probably don't have dedicated office staff.
Oh, no, we do not have billing department at all. We don't have a coding department.
You do, it's you.
Yeah. For my weight loss patients, it's me. So
crazy. I wouldn't have the first idea where to even begin.
It's a lot, honestly, but goodness. I know that if I was that patient and I've seen it change lives, that I'm just like, okay, let's do whatever we need to do to get you covered or get the medication available to you. So yeah, I've seen a lot of really great things come out of the GLP-1s if you do it correctly with lifestyle changes.
Yeah.
Like I said, I felt very supported in approaching it the way that I did. I told Mindy and Jerry, like, I'm not doing this program unless we focus on lifestyle and provide that service for them too. And they were totally on board with it.
How much of your time is, I guess, proportioned over to that wellness clinic?
So I am in clinic 1 to 2 days a week, and then I'm in the OR 3 to 4 days a week. So in that amount of time, and I'm the only I'm the only provider there that does any wellness right now. So I am currently... And it's just kind of
sprinkled into your day, or do you have a dedicated time just kind of throughout the day?
It's just sprinkled in my day because I also do in-office procedures. So I'll do like liposuction in office, areola reductions, nipple piercings, scar revisions, whatever I need to do in office. So they have those on my schedule. I have post-ops, I have consults, it's just a good variety in my day.
Can I just say something?
I knew it was coming.
You said nipple piercing.
Yes.
Is that a common, I mean, can you...
So it's actually a treatment for inverted nipples.
You finally found someone.
Yeah. And the best part... Come on in, Tyler. I can pierce your nipples.
Oh my goodness. Well, now that you say it, I mean, yeah, it'd be good. We'll talk later.
Yeah, I know. And I numb you up. That's the best part about it. I tell because I love getting ear piercings, and I told my piercer, I'm like, I have one up on you because I can numb my patients before I pierce them. So
isn't that the truth, though?
Yeah.
So you're doing quite a bit of that then? Is that pretty common?
Yeah. Honestly, I mean, I've never worked with another surgeon within plastic surgery, but Dr. Chittister gives me a huge amount of autonomy.
That's awesome.
He, as long as he feels like he's trained me adequately, or he feels like...
I must have missed that day in school because I don't remember learning that.
No, you
That's
don't.
on-the-job training.
You don't. It's on-the-job training. Like, and I'll do earlobe repairs and then pierce their ears after the earlobe repairs. Like, I don't know. I will never want to work for another surgeon again. I love all of the surgeons that I worked for, but with the amount of autonomy that he has given me,
you can't beat that.
I do most of our liposuction in surgery. I'll do some of the dissections. I'll like wedge out for breast reductions or lifts or whatever. I'll do a large portion of like the mastopexies.
What is that?
I help fix.
What is mastopexy?
Breast lift.
Oh, okay.
Lift.
Yeah. And then like as I'm repairing one edge of the diastasis, he's repairing the other. And so it's just really nice. Together. Yeah, I tell people, like, if I knew I loved plastic surgery as much as I did, I probably would have wanted to be a surgeon. But he lets me do so much that I'm like, there'd be no use for me going back to school. Like,
yeah, I love that,
to be a surgeon, because he lets me do so much. So,
and my opinion on that is it's not so much that he's letting or allowing you to do it, but he must have the foresight and the mindset of growth and efficiency to have you do that, to make everything run smoother.
Yeah.
I feel like in my experience, you get to see kind of all the different ways to approach working with the APPs. And we've heard all these various stories of everybody's situation, but you see the providers or the physicians, our colleagues and as physicians and surgeons that utilize the APP seem to be far more successful. So it seems like you probably are part of a great clinic.
And it saves him a lot of time if he's confident with me doing in-office procedures that we don't have to take back to the OR.
They can be busy doing other things,
yes.
right? Yeah.
And so we're a very well-oiled machine now. I so appreciate that he's taken the time to train me, because I know it takes time out of your day. And he's always so patient, and there's always a learning curve, but he's been just phenomenal with that. So at this point, we're pretty comfortable, and we know what each other likes, and we can kind of just read each other, and
you're like a one-to-one ratio. You're just directly with Dr. Chittister, right?
Yep.
And you follow him every OR day and every clinic day. You guys are...
Yep, we're in clinic the same days. Meg, the PA that worked with him prior to me, she's phenomenal. I love her. She came back part-time, so she'll operate with him one day of the week and then do a clinic day. And she's also actually been helping Dr. Pfeiffer a little bit too. But So Dr. Chisser basically has 2 PAs,
Gotcha.
one that's part-time, and then me. I just got so busy with the wellness stuff, I had to add on another clinic day. So, but we are hiring hormone provider right now. So if you know anybody that is interested or good with hormones,
Shout
also not something that I feel like we get a lot of exposure in school.
Not really.
Absolutely not.
No,
So-
not nearly as much. There's definitely a need for that as well.
Yeah. I
Yeah.
agree. So, of course, we're wanting to get into peptides and all
Sure.
the wellnessing, longevity medicine, functional medicine,
And that's one of
regenerative
those- and
medicine.
That's one of those areas that is just, you will see all kinds of information, wrong or right,
Yeah.
but it's everywhere, and it's all conflicting and confusing.
Yeah.
So it's
It's
all over the
hard-
place. You need a reliable resource. People that want to learn about that need to
Yeah,
have
and
somebody
I
who knows what they're doing.
I think the issue is that it's not well studied, and so
Yeah.
people are just kind of guessing right now, which makes it a little bit scary.
Yeah.
But they do have enough research to show that it's providing benefits, so it's hard not to want to provide that for patients.
Right.
So, and the research that we do have, it's enough to at least safely get them on these things like hormones or peptides, but
And we've been inundated with, these supplements companies that have come in and just said, here's the pill that's going to make you 20 years younger. And it's
Yeah.
like, wow, is that true?
yeah.
Then there's the billionaire. I was just thinking about this. I don't know why. The billionaire that is promoting like his routine that he's
Brian
going to live
Johnson.
forever.
Yes.
What do you think about that?
Blueprint. I think it's interesting. I watched his documentary too on Netflix.
Oh, I haven't seen it. Is it worth watching?
Yeah, I think so. I think it's at least interesting to see everything that he's trying. I mean, he's currently taking plasma from his 18, or he's probably like 21 or 22 now, his young son, and injecting it, like doing IV transfusions of his
Oh, weird.
son's. Yeah.
Wow. Yeah, this
So
guy
it's
is-
very
Do you know about him?
experimental.
Never heard of
Oh
this.
my gosh, you need to look this guy up.
He's from Utah.
Of course.
Is he really?
Yes.
Of course.
Of course he's from
Not
Utah.
surprising.
Yeah, supplement
Yeah.
like city here,
Yeah, yeah.
Absolutely.
Yeah, he's from Utah, and he used to
Like
be
sleeps in a hyperbarics chamber. He's like the real deal. He's,
Yeah.
It'd be interesting to see how that plays out, because if you've got the resources,
Yeah, he invests like I don't know how many millions of dollars
and
every year in
millions.
his
I
health.
can't imagine that hurts you to.
Yeah,
use
but
I mean,
that.
a lot of this stuff though is experimental.
it's
Sure.
to the extreme though
So-
too. Too much of anything, I think,
Yeah.
can be damaging.
Yeah, and he eats the same food like every day. He used to take like over 100 supplements a day. He's
boy.
narrowed it down to where he's combined a lot of his supplements, with his
That's just-
blueprint
Yeah.
stuff. So
Feeding the machine, though. I guess that's why I brought that up. It's
Interesting.
just we really do need somebody that's truly looking at the science and giving us data
Yeah.
behind
Yeah.
these methodologies and things like that.
Speaking of some of these things, what would you say are some of the challenges that you would face in plastic surgery? What are the difficult parts of the job that maybe we don't appreciate?
So I think my biggest fear of going into plastic surgery was an entitled demographic.
Okay, yeah.
It's especially where we're all elective surgery, and
Yeah.
it's cash pay. And initially, my thoughts on plastic surgery were, oh, this is just women wanting to come and they care way too much about their looks.
Yeah.
That is not the case.
Debunked
I got
right
proven
here and there
wrong.
because I would have thought the same thing. I'll be honest with you.
I honestly have the best patience. And you'll get one here or there that's upset for whatever reason their schedule was wrong, or financially they feel like they shouldn't have to pay the amount, whatever it is. But most of our population is moms who have had like 5 or 6 kids. We're in Utah,
course.
and they have kids very young, and they're just very grateful to get their body back. So that's why Chitty calls it mommy takeover, because it really is like these women that are taking their bodies back.
Yeah.
Like it's the takeover. So that's not an issue. I think for a while, being the only APP, the only PA, it was difficult because I was the only one doing my job for the whole clinic. And as we started getting more surgeons, I was like, okay, my workload is expanding.
Yeah.
And I think I definitely work more than 40 hours a week, which I actually don't mind. My lifestyle allows that. I don't have kids. I'm not married. It's fine.
Yeah.
You're going to the spa every day.
I know.
I'm going to the spa every day.
Let me say this real quick. When you brought that up, I immediately thought of, so our surgeon is so gracious, and when we reach our 3-year mark, he sent every one of the APPs to Mexico.
Oh, that's
to an
awesome.
all-inclusive resort. This resort is like nothing I've ever seen before. Correct me if I'm wrong, but I told this guy, because I went before he did, I was like, the smell. You walk into the building and there's something about the smell that just like takes you in. And I thought I likened that because I saw the pictures on your website, and I mean,
you guys need to come visit, because they literally have a scent for the spa, and it's different in the clinic, and then it's different downstairs in the OR.
It's intentional. You guys are doing that.
Yes.
I mean, meeting all the senses, right?
Yeah. They've shown like scent
changes
actually
mood.
makes the experience.
Yeah.
It's part of the experience.
Happy, so I'm definitely
come
coming.
visit sometime.
Yeah, absolutely.
The smell, people will comment on it like, it smells so good in here. I'm like, well, it permeates into all my clothes and bags. So
that's awesome. Well,
no, it's awesome. But
the balance, then we were kind of talking about
the
hours that you work.
balance.
I'm trying to distract the conversation. I'm so sorry.
I love
totally
it.
fine. No, I think with Dr. Chittister specifically, he has done so well for himself. One, he's gotten great exposure through social media. He actually really enjoys social media. It's a hobby of his.
Yeah, anyone listening, if you haven't looked, take a look.
Yeah, for sure. It's at Dr. Chitty.
There you go, at Dr. Chitty.
He's great with social media. And so, but then he also produces really good results. And so the combination of the two, it's allowed us to help a lot of patients. And because of that, we try to pack our days as full as we can. And, we have the next 4 years planned out for us pretty much.
That's
so
wild.
Yeah.
Which means my thought is, how do you take a break or take a day off, or something comes up, you need to be out of clinic, but it's already scheduled 4 years out?
Yeah.
Is that difficult?
Clinic isn't scheduled 4 years out for me, luckily. Okay. And to be quite honest, I try to plan my vacations around Dr. Chittister's. He has to schedule a year in advance at least for his vacations, and he didn't take vacation for a while.
Yeah.
And then his patient care coordinator was like, no. And his wife, like, no, we are blocking off time throughout the year so that we can actually have family time. So I try to plan my trips around that. But what's nice now is that Meg is back part-time.
So you've got some backup.
Yes.
That would be challenging if you're just on an island and you don't have a resource.
Yeah, I think that really was the biggest challenge when I first started. It's like, if I'm sick or if I do have a vacation that's not aligned with his, I don't have anybody that can cover for me.
Or even just some clinical support if you have questions. You're always questioning everything. But for us, it's helpful because there's usually multiple of us in clinic on any given day. So if there's something unique, or you just want a second set of eyes on things, it's super helpful to have someone else.
Yeah. Absolutely. It really is. It's made a huge difference, and she's been a PA I think like 13 or 14 years, and so it's nice just to have that camaraderie and we can go back and forth on what we think about certain things. I'm happy to cover for her whenever, she's happy to cover for me whenever.
And it's also from an emotional standpoint, like just having somebody that's on your same level and sees the clinic and the way it operates the same way you do, and feels the same that you do in certain situations. It's nice to have somebody to turn to. Yeah,
she understands the role more than anybody else, so it's very nice. Let's see.
How about this question? I'm getting the sense that there's an overwhelming majority of females that come to see you.
Yeah.
How many males do you get coming in?
Wait a minute. Let me say this because I thought about this too. Okay. So I was driving home one day, and it's somewhere in Orem or Provo. There's a billboard, and normally it's the mommy takeover or makeover.
Yeah.
There's the dad bod.
It was the dad bod. And he had a transformation, and I was like, that's pretty good advertisement. So go ahead, answer the question now.
No, I love that question because I really truly feel like it's becoming destigmatized for men. Do they like broadcasting it? No, they don't. But I will say, especially with the GLP-1 movement, we're seeing a lot of major weight loss patients.
Oh, yeah. I can imagine
Guys
that.
coming in that have lost like 170 pounds and they need that excess skin taken off and they want to show off their hard work that they have done. And so we don't do a lot of body lifts, but I know Dr. Pfeiffer, he does a lot of guys, and Dr. Robinson also will do a lot of major weight loss patients.
Are we talking like excess skin? Is that kind of the big deal?
So it's called a paniculectomy, where they take out the excess skin from the abdomen, or a thigh-plasty, where they'll take out excess skin from the thighs, or a brachioplasty from the arms. They can get a full body lift or an upper back lift. I mean, some of these guys have a lot of excess skin, which you guys know can cause issues, infections and rashes and whatever.
I'm trying to find out how to get rid of these dad handles right here. You know what I'm saying?
Come in, we can do liposuction in office.
Can I just tell you, my 10-year-old son, he's been doing it for like 2 years now. He comes up behind me. If I ever have my shirt off at home, he'll come up behind me and slap the love handles.
Kids.
And he'll say, "Dad, you have belly cheeks."
Wait, that's so cute.
Yes. Just like a huge boost of confidence every day.
Humbles you every day.
I know.
Every day. You work so hard. I'll be done working out.
Nobody can bring you down a peg like your own kids.
That is so cute, though. It's so innocent, too. Like the belly cheeks.
That's the worst part is it's sincere. That doesn't help.
No, I love it. But no, we definitely treat guys. A lot of the cases that we do liposuction, for sure. There's some high profile patients that Dr. Chister and I will operate on that you can't say,
of
but
course.
A lot of athletes or bodybuilders that maybe have stubborn areas, and they like work so hard, but they just need that last little bit to get to exactly where they want to be. We do a lot of gynecomastia surgeries, and so getting rid of excess tissue, breast tissue in males. I'd say those are kind of the most common. We don't do face stuff yet.
Coming.
Of course, Dr. Chister's well versed in it, but we're focused so much on mommy takeovers right now. But a lot of guys will get like blepharoplasties, where they take excess skin off the upper lid so that you can see better. Facelifts, rhinoplasties, all of those things. Guys can definitely be good candidates. I know a lot of guys are starting to do Botox or Dysport. A lot of guys are starting to do more lasers and facials, and I think that's great. I think it makes anybody feel good being pampered, and I do think it can help boost confidence. I know a lot of guys who have an insecurity about something or another, and to be able to address that for them is pretty cool.
Yeah, I agree. I think it's definitely out there. Whether people want to openly talk about it is one thing, but I think everybody does have their things that are kind of present in your mind that you think about. Yeah,
and like we try to be champions of empowering women and men, just in making their own decisions and getting to a place where they're just more confident. Dr. Chister actually got liposuction 9 or 10 months ago, and he was very, very vocal about it. He posted all about it online, and I think that was important because it showed guys that, like, hey, this is okay. You don't have to be super vain to get this done and feel better about yourself. And I think our generation especially, we're very stressed, we work a lot, and to be able to do something for yourself is awesome.
Gotcha.
Are the liposuctions being done in office or in an OR, in your OR setting?
Both.
Wow. Depends on the invasiveness of it?
Yeah. So my cutoff, and really what ASPS, a plastic surgery board, will say is that like a leader is safe to do outside of the OR. So if it's a small area or it's a touch-up or something.
A leader is a touch-up?
Yeah. It's still a lot, but that
I'm ready to quantify this right now.
My belt's a little tight right now.
It's always shocking how much you can get out. We'll have women come in that are like 105 pounds and 5'4". They're just tiny, and we'll get at least like half a liter off of them. Like somebody that you would look at and be like, no, you definitely can't get any fat off of them. You always can.
Yeah.
So
that's crazy. I know. I gotta just go on this for just a minute. The success rate when you do liposuction, what's the expectation? Are they gonna get it right back, or is it something?
Yeah, is this like the once a month come in and get your touch up, or
No.
is this?
So there's a lot of misconceptions about this, so I'm glad you asked.
I'm clearly interested in this.
Yeah,
While you're getting your piercing, you might as well.
Yes.
We're gonna do your liposuction,
daddy
your nipple
makeover.
piercing. Yeah, you're gonna have your dad bod here
I
pretty
can't
soon.
wait. I can't wait.
Oh shoot! My pockets aren't deep enough, unfortunately.
That's the one thing. How people pay for plastic surgery, I'm like, I'm glad you have that kind of money because I'm still paying off my student loans. And
Yeah, isn't that the truth?
yeah. But so with, let's see.
The plastic, like the lipo, is that a durable thing?
Yes. So a lot of people think like, okay, once you take out fat from somewhere else, it's just going to grow elsewhere. Not the case. So what happens when you lose or gain weight? You actually have the amount of fat cells that you're ever going to have. So when you gain weight, they get larger. When you lose weight, they get smaller. It's not like they ever disappear completely. So what liposuction is doing is that we're going in there. It's pretty barbaric. We're taking a metal rod and we are sucking out those fat cells. And sometimes we fat graft and we place that fat somewhere else, like the breasts, or we'll do Brazilian butt lifts, hip dips. That's very popular right now is fat transfer, fat grafting. But once you remove those fat cells, they're not there anymore. Oh. That being said, if somebody gains weight or loses weight, now you have fat cells in other places that may grow or shrink.
That's interesting.
So say we do fat grafting and we place the fat in a woman's breast. If she loses weight, that fat's going to shrink. If she gains weight, that fat's going to grow. So it's definitely a misconception that you're just going to like get fat in other places or it comes back. It won't ever come back. But again, the mechanism of weight loss and weight gain is still there.
Interesting.
Yeah. And what may have been a problem area for you before, if we liposuction there, now you may have a different problem area if you gain weight. So.
Never thought about that.
Yeah. So it's usually a pretty good.
The more you know.
Yeah.
I tell you, we learn something every time we do this.
It's truth.
And it's so fun because, you get to redistribute the fat. Fat's not a bad thing. It's just
Be in the right place.
we like it in the right places. Exactly.
Yeah.
That makes sense.
So
Yeah. Maybe like a little bit here,
yeah.
over here.
Yeah. Yeah, I know, right? You definitely.
And then I can eat all the cookies and it gets bigger.
Yes.
That's what I'm learning.
Yes.
Your
No.
chest, your arms, everything's just bigger.
That's how we do it.
You're going to get huge.
Yeah.
You're going to get huge.
Cookies
And it
aren't
won't be
secret.
saggy at all.
Yeah.
It won't.
Yeah.
Rock hard. Yeah.
It's actually funny you say that because there's a surgeon down in Colombia, Dr. Hoyos. He's a phenomenal plastic surgeon, but he's doing a lot of fat transfers or fat grafting to like the rectus abdominis muscle. And they'll like contour and define.
Oh, to like recreate the abs?
Yes, or they will do it in the deltoids.
No kidding.
Yeah. So you really can do that.
Please send me his contacts. I'll just get a
I thought I just created something. I guess not.
Yeah, no,
you
but
did.
you were on the right track.
train.
Yeah,
Okay.
exactly.
Let's jump gears for a minute. I'm really interested to know this. Tell me about pay structure in plastics.
Because you're talking about doing your own thing and it's all
Yeah.
cash based. So I feel like there's got to be decent compensation for what you're doing.
Yes, yeah. I definitely get taken care of for sure. So my base pay, it's, I would say more than average for a surgical PA in Utah specifically. But on top of that, it's really nice because I can get compensated for wellness patients. It's not a lot for the wellness patients, but it's something, which adds a lot to my paycheck. Whenever I do a procedure in office, I get 20% of those procedures, which is great.
Cool.
On top of your salary.
This is all on top of my salary. And then I also take call every day except for Saturday and Sunday.
Every day.
Every day.
Whoa.
When I say that, though, it seems awful, but when I was doing general surgery, I was taking like 15 days of call a month sometimes.
That's
a different kind of call. That's like you're getting called every 20 minutes from the nurses on the floor. And, you know, you can't be mad because a lot of times it's needed.
Legitimate needs, yeah.
And then you're getting called in for an X-lap from a gunshot wound at 2 a.m.
Yeah.
And then you get done at 6:30 and then you have clinic at 7, you know, or you have to go round before clinic. It's not like that. It's like patients calling me being like, hey, my back drain's putting out a lot of fluid. Like, is that normal? And it's like, yes. It's more of a reassurance call.
Yeah.
You know, it's very rare that I have to go into the clinic. I think in my whole time of being with Dr. Chittister, we've only had to go in, take a patient back to the OR once or twice.
Oh, wow. I was interested in that because being such an elective thing, the process, if there were to be a complication, and how do you handle that?
Yeah,
and you're so busy as well that your schedule's already stacked up.
So
totally off
busy.
the topic of pay.
No, and we'll get back to it. But with our schedule, if it's an emergency, you know, we'll fit them in early mornings. Like this morning, we went in super early to fit a patient in that had a complication, and we just figure it out. If it's more emergent, like a breast hematoma, for example, if we're doing an explant and they have a hematoma, we have to go do a washout. The nice thing is that Dr. Chittister and all of our surgeons are board certified in plastic surgery. And so what that means is they can get credentialed at any hospital, which we are credentialed at Lone Peak. So if it's an emergency where we have to take them back to the hospital, we can just take them straight to the hospital. Now that he owns his own surgical center, it's very easy because we can just go to the surgical center, and we have overnight stay capability there.
Oh, really?
Yeah.
Oh, wow.
So we really haven't been to the hospital in a while. And I will say, you guys are probably going to be really jealous of this, but our patients are extremely healthy.
Yes. Yeah, I figured.
We will not do surgery if they're not. If they're smokers or if they have a BMI over 28, that's our cutoff. Yeah. And coming from bariatric surgery, it's, you know, complications decrease significantly with their BMI under 28. So
I imagine. And the surgical technique, that's the other thing I didn't appreciate.
Yeah.
Is actually the surgeon having to do what they're doing when someone's BMI is 40, 50.
Yes. It's a whole different beast.
The whole thing. Mm-hmm.
So, you know, and that being said, it lends well to us having a wellness program, because if a patient isn't at their ideal weight or they're not at a weight where we could safely operate on them, they work with us. I like them to be weight stable for about 3 to 6 months before we operate on them. But usually, since we're 4 years out, we have enough time to work with them and get them to a place where they're going to have safe surgery, but then they're stable for a while. Back to pay.
Okay.
So 20% of procedures, I do get call pay. It's not very much. It's not like the hospital, but the demand and the workload is far less too.
But it's the idea that you have kind of your steady base income, but you do get paid extra for other things that you're doing.
Yeah, so I have incentive to hustle, and I
think that's nice.
I love doing in-office procedures. The fact that I get 20% of those is an added bonus. Mm-hmm. So the compensation there, I don't feel like there's a glass ceiling like there are in some jobs.
Yeah, absolutely.
It's not based off of productivity really, which I like because I can focus on the patient. I mean, technically, if I wanted to be like, okay, let's get 5 liposuction cases in office, but there's no pressure of seeing more patients.
It's good to have a balance too, because I find that on either end of the spectrum, you can run into issues, right? If it's just completely eat what you kill or a percentage of it, then you're just trying to churn patients, and I think care diminishes. But on the other end, if you just set a salary and you cap them, then it's like,
what's the incentive?
Where's the carrot? Where you talked about that carrot that we all want. So it's finding the balance. It sounds like you've got that.
There's a good balance, and I think too, like, I have great benefits on top of even my salary and the bonuses that I could potentially get or commissions. So They pay for a lot of my insurance. They pay for CME every year. They pay for my AAPA membership. There's things like that maybe we don't talk about as much that are still huge benefits. And, you know, that's money that could have been out of my pocket that's now covered because they care about my growth and they care about me developing as a provider.
Are the plastic conferences bougie? I mean, are you going to like exotic places and like?
I mean, this last one was in Austin, Texas, which I loved. I had never been to Texas before, but they're pretty bougie.
Yeah.
They, you know,
Do you
it's
some
like
barbecue?
They probably wouldn't even let me in the building. They'd be like, "Yeah, you can't."
Well, you go and there's like, you can tell it's a plastic surgery conference. You're like, you're beautiful, you're beautiful, you're beautiful. But you go and they're also handing out like free skincare and
yeah.
So it's kind of what you'd probably expect.
Cool.
They're having fun dinners and parties and
yeah,
very cool.
That's cool.
But then you're also learning a lot and it's really cool. I think the plastics space in general is very collaborative. I mean, there's always going to be competition, especially in Utah. It's the highest, behind Miami, it is the highest amount of plastic surgery per capita in the
Oh my goodness.
in the world, really.
You're surprised by that?
Not, I mean, I knew it was pretty rampant around here. I guess I didn't know top 2 in the country.
Yeah, and that's per capita. So Utah's a
Sure.
smaller state, but the fact
But
that
the percentages
there's
are
so much
high.
happening here. And I think, you know, we have a young population and we have a lot of people that do care about what they look like. They're usually healthier and
a lot of
like I
babies.
said, a lot of babies. Yeah, a lot of
Yep.
moms. And so,
fair.
and the thing that I think also people don't understand is that like an abdominoplasty where we actually fix the diastasis that occurs during pregnancy. We take off that excess skin. You cannot get rid of that with exercise. So no
Sure.
matter what people tell you, like
Yeah.
you can build your muscle so it's a little bit closer. You're never going to get your muscle edges back together. And so that actually helps a lot with function. We have women coming back saying like, I no longer have back pain. I actually don't pee my pants anymore.
Yeah.
Like their sex life is better. They have more core strength. So really any activity like skiing, we had a patient that was like, I was beating my kids on the slopes like 6 weeks
Cool.
after
Great.
surgery.
Yeah.
So I think it ultimately it helps with longevity because you're going to have a more active life if you're able to actually function more appropriately.
Makes sense.
There are some women who have such a big diastasis, so we have to send to physical therapy after we repair their diastasis because their muscles don't fire the same way. They're not
Wow.
getting, the same messages or able to respond to those messages as well. It's just not firing appropriately.
Sure.
That's crazy.
So the fact that insurance doesn't cover it is very frustrating for a lot of us.
Because there's actually like a true benefit to
Yeah.
it, like a physiological or physical benefit
Yeah.
to it.
Yeah, there really is. And so it's rewarding for us to see that, but it's also like not all women have access to that because it is expensive.
Yeah.
Absolutely.
How about we finish up with story time, which is always fun. We've had a few
Awesome.
people share some fun, some interesting, some
You
tear
need to go
jerkers.
back and listen to them because you're going to be like,
Okay.
oh, wow.
Yeah,
Okay.
now I don't even know what I'm up against.
No, that's good. That's good. We just want it to be raw. Just let us know.
So do you have any memorable patient encounters that you feel like, because everybody's kind of sitting around the dinner table, everybody could share their favorite stories.
Yeah.
Anything memorable in your world?
Lots, yeah. Like I said, I have really great patients that are just really grateful for the work that we're able to do for them. But I think the most rewarding ones, I had this patient in particular that came in. She's extremely overweight. Thought she would never be able to lose the weight. We got her to her goal weight. And the fun thing is I'm on this end of the spectrum, and then I get to go operate on them.
Yeah. Like
Yeah.
And
weight
it's
loss
like
cosmetic.
full circle. So it's these moms who literally have been sacrificing their whole lives, their body, to their kids, their families. So this one in particular, basically was hopeless. She was just like, I'm never going to be able to get to my goal. I'd really love to have a mommy takeover, but it's just not in the cards for me. Then we work with them. they get to their goal weight, and even that alone, it's just like they come in tears, and they're so grateful, because a lot of these patients, as we know, like obesity, it's a vicious cycle, because you become insulin resistant and then you're not able to lose weight as quickly or as efficiently. But then the cherry on top is that we were able to operate on this patient and like take her from this place that she never thought she'd be able to like do activities with their kids anymore or live long enough to see her grandchildren. And now she has full function of her abs, and she loves the way she looks. She's been able to wear a bikini for the first time since she, started the whole journey. Yeah. And we're actually, I don't know how much I can say about this, but they are doing a TV show about our clinic here pretty soon. They're pitching it. There's a couple of networks that want to pick it up, TLC and Hulu and stuff. But you guys will have to watch, because it's patient stories. So like seeing these patients from beginning to end.
The transformations.
Yes.
Gosh, very cool.
Yeah.
He's not going to love that.
Yeah.
So that will be really fun to like showcase our patients that have worked so hard, and kind of tell their stories. I will say I get asked all the time, because Dr. Chister operates on a lot of influencers, and I always get asked, who is your favorite one? Who is actually nice? And it's like, there are patients, and most of them, I will say, are very, very, very kind. And so,
that's cool.
How many TikTok videos have you?
Have I been in? Not very many.
Okay.
It's usually like the younger girls upstairs that run the front desk that do TikToks.
Yeah.
So what happens is usually like I'll be finishing up surgery, and that's when he goes upstairs and does TikToks with like the girls, because that's the time that he has to do them. But I've been in a few.
Okay.
Yeah, I've been in a few.
I appreciate that.
We'll have to check it out. Yeah.
Social media is tough.
It's hard, and I'm not one that really likes to put myself out there. Even like with the show that's coming up, I'm a little bit nervous, because I'm like, I don't want to get criticized by people who don't have my best interests at heart.
Absolutely.
Like,
that world can
get torn to pieces.
Oh, yeah.
I even see like Dr. Chichester getting talked about poorly, and I'm like, but he's the best guy. Like, why are people? But there's just trolls, you know.
Absolutely. And that's why I don't pay attention to it, because I figure ignorance is bliss. If I don't hear about it, I don't care what you're saying about me.
Yeah.
But that's cool that you're going to be a part of that. I mean, I think that'll be rewarding to see the fruits of your labor, like through another lens. Like you're able to step back and see how other people are perceiving your clinic, and it sounds like you guys are doing wonderful things. So
yeah, it's been fun to see the growth even since I began. And I think it's fun to work in an environment where innovation and everything is at the forefront. Like Dr. Chichester is like a early adapter for everything. Of course, we always want to make it safe for our patients and make sure there's evidence behind it. But like he is willing and does put out most of the money that he makes back into the clinic, back into the surgical center, to make sure we have top-notch technology, lasers, everything. Some of these technologies are a really, 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 really nice car, and so and to have that come from his own pocket, it's a lot. But
cool.
I think that's why he's gotten to the place that he has, and why his patients end up looking so good is because he is willing to invest in them.
Love it. Well, Shelby, this has been a ton of fun. I've learned a bunch.
Yeah.
We appreciate you coming.
Now I want to hear about your guys' specialty. I'm like, wait, tell me.
I don't know that we can hold the torch to what you just.
Everybody's got such cool experiences.
I mean, I guess it's
just
stories. Because it's new. It's something we haven't seen. I mean, we love what we do, but it's so rewarding to be able to sit down with people like you and just hear kind of your area of specialty and all that you do, and that's just awesome. So
and I think it's fun. We kind of took the same pathway, but then you end up in such different places, and maybe it's not the place that you even imagined. But I think like, this is my life job. I'm
You're
never
not
going to
going
leave.
anywhere.
Yeah.
Yeah.
So
Yeah, it's been fun to see everybody's story and kind of hear.
yeah,
everybody's
it's
experience. It's been
awesome.
fun. Well,
Don't ask me.
It's
Don't ask
how we
me.
it's how we do this. Tyler, what'd you learn today?
Man, I learned a ton. I I already
can't
had
wait.
respect for plastics. Having worked in the OR and closed incisions and things like that, I understand how, the surgical technique is such an important aspect of it. But there's the
Yeah.
world of plastics that you just described, just opened my lens. And even more appreciative of what you guys are doing. And love to come to your clinic. I'm excited
Yeah.
actually to make we're going to
should.
do a tour.
We gotta do a
for
couple
No,
visits,
seriously,
yeah.
come in. You guys, the other thing that's really cool is we're kind of trying to make it a center for education and bring providers from all around the world to collaborate and learn from each other. So even if you wanted to come in and hang out with us for a day and just
That'd be
see
so
what we do
cool.
in the OR, you're more than welcome to.
Oh, that's awesome. Yeah.
So-
That's
No,
awesome.
yeah, I've learned a ton. I can't even recap because my mind's just spinning of all the things. We had some great conversations.
Yeah.
Learned a lot, though. Appreciate the time, Shelby.
Yeah.
How would somebody catch up with you if they wanted to follow up, had questions, or get to know you a little bit better? How would someone reach out to you?
Man, I think because of just the platform that Dr. Shitty has, I always have to be available on Instagram. So Instagram's a great place. It's at Shelbi Brook, PAC. And it's Shelby with an I.
Yes.
Clarifier.
I'm always open. Like, if you email me, it's Shelby at the Plastics Clinic. If you're wanting to shadow or if you're wanting to do a rotation with me, I do take students, especially from our alumni.
She's
so
4
that's
years
great.
out. Just let you know. No, I'm kidding.
Yeah, I know. But I love doing that. So reach out to me, however, and I'll try to get back to you. I may not be the best in responding because it's so busy, but I try.
Perfect. With our clinic, we have kind of a social media gig as well.
Awesome.
So we're Instagram at Summit Brain, Spine, and Orthopedics. On YouTube, the Summit Medical Institute. And then we like to see people in person. We do an interdisciplinary case rounds presentation every Tuesday morning at 7 a.m. at the Mountain Point Hospital in Lehi, Utah. We'd love to see everybody there. We always want to give a shout out to our production team behind the camera, Dallin and Amelia, helping us out behind the scenes. And we want to hear from anybody that's listening. If there's anybody out there, leave us a review, a comment, like, click, subscribe, all the things that you always hear. We'd love to get some feedback from anybody that's heard the show and what we should do in the future. We got a couple fun ones coming up. We're kind of getting towards the end of what we're going to call season 1. And we've got a couple great ways to cap off the season, so stay with us. Anything else you want to add? Love it. Okay.
Awesome.
Well, as always, I'm Alex Davis, PA.
I'm Tyler Murray.
Okay. We'll see you guys next time.
Are you ready for this? Are you ready for this? Are you ready for this?